and I'll turn it over to Michelle Adams.
Thanks, Jen. Good afternoon. The National Center on Early Childhood Quality Assurance is pleased to bring you today's webinar on staffed family child care networks, improving access, quality, and sustainability. And as Jen said, we'll be introducing 3 new resources that focus on building the supply of high-quality family child care through staffed family child care networks. I'm Michelle Adams. I'm a Technical Assistant Specialist with the National Center on Early Childhood Quality Assurance, and I'll be your facilitator for today's webinar. The Quality Assurance Center provides training and technical assistance to support state, community, and tribal leaders in improving the health, safety, and quality of child care settings. The center works across early childhood sectors to advance strong licensing regulations and quality initiatives, to encourage the development of culturally and linguistically responsive policies and procedures, and enhance systems development through the use of research, data, and technology. The Quality Center has developed a series of 5 resources that's addressing the promising strategies for states, territories, and tribes to improve the quality of care and engage and sustain their family child care provider participation in regulatory systems and in quality improvement initiatives. Today we'll be sharing information about those first 3 resources in our series. And to help us do that, we're pleased to be joined by 3 presenters. Dr. Juliette Brummer, a research scientist with the Her Research Center for Children and Social Policy at the Erikson Institute in Chicago, Illinois. Juliette is currently the principal investigator of the National Study of Family Child Care Networks. This is a new research initiative examining effective supports for home-based child care. We're happy to have you today, Juliette. We're also pleased to be joined by Jessica Sager. Jessica is the co-founder and chief executive officer of All Our Kin, a staffed family child care network in Connecticut. And we also have Gina Capito. Gina is an ECQA consultant and an author of our cost estimation tool. They'll be here today to discuss the role that the family child care networks can play in supporting providers. They'll share key considerations for developing a staff network, and will demonstrate the use of the cost estimation tool. In an effort to keep our webinar to 1 hour, as Jen mentioned, we're going to ask you to please type your questions into the chat box. If our time permits, we will answer questions at the end of the webinar. Otherwise, we'll capture your questions and respond to you on an individual basis via your email address that you provided at registration. So we'll go ahead and get started. The first resource in our series is entitled Staffed Family Child Care Networks, a research-informed strategy for supporting high-quality family child care. This resource provides research-based evidence and best practices for supporting family child care providers and improving quality of care. So Juliette, I'd like to start with you if I could.
Sure.
You've authored numerous peer-reviewed articles and reports on quality in home-based child care, and you co-authored this resource with Tony Porter. Will you briefly share with us today what you've learned through your research about networks and how they can help improve the quality of family child care?
Sure. Thank you, Michelle. I'm excited to share with you and all the listeners here about this new resource. But before I get into networks, I want to start with this slide because I want to remind everyone on the webinar why we should be paying attention to this sector of the early care and education workforce and why support matters. So I just want to remind all of us that home-based child care providers make up a substantial proportion of the child care workforce. We know that a majority of infants and toddlers are cared for in these non-parental child care settings while their parents work or go to school. And this is especially true for parents who are holding down low-wage jobs with non-standard work hours. The National Survey of Early Care and Education is our most recent data source for family child care and other types of home-based child care. And we've learned from that survey that 4 million providers in our country, including a third who are paid family child care providers, are caring for over 7 million children under age 5 and an additional 2 million school-age children. And in addition, we know there are many potential strengths of family child care, and that quality child care can really happen in any setting. And I always like to start with that as well, and just to remind all of us that quality is really, I think we really understand from brain development science and from the research on child development that nurturing provider-child interactions and relationships between adults and children are really at the core of quality. And so if we think of that, then quality can really happen in any setting, whether it's a center, a preschool, or a family child care home. And yet, we also know there are some particular and perhaps unique barriers to quality improvement in family child care settings, and that the quality of care across many child care homes is mediocre to poor, and we know that from some of the national research that's been done on quality. But some of the barriers or the challenges to quality in family child care, and again, I think these will be familiar to our listeners, are the isolation that providers face, the role burden. Providers are often caring they're caring for children in their home, but they may also have other family obligations, and many providers hold down other jobs in addition to child care. Family child care providers may not have the same kinds of access to information and resources and trainings that other early childhood professionals have. It may not be easy for them to leave their homes, or they may live in neighborhoods where there just aren't those types of resources available. And then finally, we know that caring for mixed age groups, one of sort of the hallmarks of family child care, is really challenging. Also a wonderful opportunity for quality, but a challenging area for providers. And so I think the prevalence and the particular challenges really are reasons for us to be thinking really deeply and carefully about how we can support quality in these settings where so many children and families, rely on. And so family child care networks are one research-based strategy for improving quality and sustainability in family child care homes. And I emphasize quality and sustainability because if a provider doesn't stay open and can't sustain her business, and then it doesn't matter about the quality if she has to close her doors. So we really need to be thinking about both of those things at the same time. And networks have the potential to reduce barriers to quality and to help providers improve their caregiving practices. In general, staff networks offer a menu of comprehensive supports to home-based child care providers, including licensed or regulated family child care providers, as well as family friend and neighbor caregivers who may or may not be interested in moving through licensing and quality systems. And yet we have a very limited research base, yet some of the broad areas of practice that are indicated in the literature and are described in our research, in the research brief. And I'll just outline the 4 sort of key areas that are in the brief, and I know that Jessica's going to touch on these in her presentation as well. But one is that networks that have a clear articulation of outcomes and how the services they deliver to providers are connected to outcomes are more likely to have a positive impact or to be effective in their work with providers. And we've looked a lot in the literature at the importance of provider outcomes as an intermediate outcome on the way to child and family outcomes. And too often, I think in our field, we skip right to the child outcomes. But in family child care, where the provider is the program, it's so important to think about how do we support the person, the provider, her resources, her information, her skills, as a way of getting to those important child outcomes that we, of course, all care about so much. So really networks that can articulate how the services really meet provider needs, engage providers, and then ultimately help them improve what they're doing with children and families. We've learned that networks that offer both individual supports in the child care home. It's really important to have on-site technical assistance, but we know providers also need that peer support, and that can happen through training or peer support groups. But both of those opportunities, that one-on-one individual TA in the home, but then also those opportunities to share with others to reduce that isolation is really an important part of effective networks. Networks also have the potential to develop strong relationships between the network staff person and a provider. So the networks we define networks as having dedicated staff who work with family child care providers, who really, that's their job, is to understand family child care, understand what quality looks like in those settings, and to engage providers in the work of improving quality. And when those relationships are collaborative, respectful, and responsive, there's some indication that providers may be more likely to engage. And a lot of that research actually comes from the family engagement literature of how programs engage families is quite similar to how networks engage providers. And then finally, thinking more about those staff and who are the people in networks who are delivering support, we think it's really important to think about what skills and knowledge those staff have. There hasn't been enough research done on the staff and the coaches and the visitors and the consultants who do this work with providers across agencies, but I think we really know that they need to what we've heard is that they need to understand both child development and adult development, because ultimately they're going into homes to work with providers. It's adult to adult work within the context of caring for children. So really having that child development knowledge across the age span, right, because the providers are caring for mixed ages, but then also knowing how to work with an adult around the issues that come up. So I'm going to close there and turn it back over to Michelle. And I just want to say one thing, which is that we are at Erikson leading a 3-year initiative on understanding networks better, really trying to identify what are effective networks and add to the very small research base so that we perhaps could come back next, in future years and have even more evidence to share. So thank you so much. Michelle, back to you.
Great. Thank you so much, Juliet, and we certainly appreciate the partnership that we've had with you. We've learned a lot from your research and additional papers, and we thank you for partnering with us in developing the brief, and I hope that folks will dig into that and find it useful.
Michelle, this is Jen. Can I just interject a second?
Sure.
Hi, everyone. If you have questions, if you could put them into the chat box, I'll be able to help you, or we'll be able to help you a little better if you can just type those questions into the chat box. Thank you.
Thanks, Jen. Okay, we're going to move on to our second resource in our series. And this resource is entitled Developing a Staffed Family Child Care Network. This is a technical assistance manual, and it explores the critical components of a staffed family child care network. It also outlines the 4 essential elements of effective networks that Juliet just mentioned, and it provides key considerations for effectively implementing a family child care network and supporting the family child care provider community. Looking at these 4 essential elements of networks, Jessica, I'm glad that you're with us today. I'd like to get you involved here and ask you about the 4 essential elements that Juliet referred to: developing a theory of change model to identify those clear outcomes and guide the network services, identifying the service delivery strategy that meets the provider's needs, focusing on building relationships, especially through on-site and peer support, and providing that training and support for the network staff who are working directly with providers. As a co-founder and CEO of All Our Kin, You've implemented a successful family child care network, and you provide support for providers on a daily basis. Could you tell us about your model for All Our Kin and how you've incorporated these essential elements into your key principles for your network?
Yeah, I'll be very happy to do that. And let me say, first of all, that it's an incredible honor to be part of this webinar, and that it's such a delight to go right after Juliet, because she says everything that we believe in and try to do at All Our Kin. And so, you know, it's music to my ears to listen to her. And I'm going to try and share some of the ways in which we have tried to put into practice what her research tells us so compellingly is most valuable in changing the quality and accessibility of family child care programs. So first, I'm going to go into our service delivery strategy. I'm going to go through the 4 bullet points, but let me start by telling you just a little bit about our theory of change. I think we do have very clearly articulated outcomes for our work, and we really focus on how we are transforming the supply of safe, licensed childcare, how we are changing the quality of that care, and how we are supporting caregiver earnings and supporting caregivers as business people, because as Juliet pointed out, you really need to have both in order to be successful. So we have built a pretty holistic model for supporting family child care providers at every stage of their development, from the family, friend, and neighbor caregiver to the licensed family child care provider, and then beyond to become that truly wonderful caregiver whose quality is excellent and whose business practices are strong so that she can do this work for years and years to come. So in terms of our service delivery strategies, we describe what we do as a quality highway, because we want to welcome in, we want to build on-ramps for caregivers at every stage of their development. So you can come to us if you've done this work for 30 years. You can come to us, again, if you're just beginning to think about whether licensing might be possible for you. So the first step is our licensing program. This is a way to engage maybe someone who's run the Sunday school at her church for years, maybe someone who's been caring for children in her home for years already, and help her complete our state's licensing standards. We find that that process is really critical in terms of helping her meet certain basics around health and safety, around helping her join a professional community with oversight. But most importantly, through our licensing process, we're continually reinforcing the message for caregivers that they are professionals with an awe-inspiring responsibility, and that they are embarking on a journey of lifelong learning with us, because that's what they go on to do. They go on to join our family child care network, which is a very rich menu of services, again, rooted in the principles Juliet describes. And I'm going to talk about those principles on the next slide. But let me first describe our service delivery strategies, which really break down into services that improve quality and services that improve business practices. So on the quality side, we have coaching and mentoring. We have professional development offerings that we deliver on site. And we have scholarships and materials to help caregivers learn and grow and take advantage of classes in their community. On the business side, we have a proprietary entrepreneurship series of business training, as well as business coaches to deliver one-on-one support on that aspect of the work as well. We have a zero-interest loan program, and we have a big annual conference where we bring together family child care providers across the state to learn and grow together. I won't go much into our other programs, but I will share that we do have an Early Head Start Family Child Care Partnership. Some of you have heard me present on that before, and I'm happy to engage with you around that offline, because it's been a really wonderful way for us to engage a subset of our family child care providers and deliver really high quality, holistic services to families in great need. And we have a training and technical assistance initiative where we are sharing some of All Our Kin's best practices with agencies in other parts of the state, and we're beginning to deliver that technical assistance in other states as well. Now, the best practices are really crucial because what I've gone over with you is our service delivery strategies, but you can look at those strategies and not really know anything about us. It's the how of what we do that really enables us to make the kind of difference that we want to see in terms of building quality programs for our youngest children. And these principles of ours really align with what Juliet has talked about. So the first thing is that we model excellence and professionalism. This gets to the piece around training and support for network staff. We know that family child care providers are doing incredibly difficult work day after day, and we want to value what they do, and we want to value their time. That means we're never going to send someone into a program, we're never going to bring in a trainer who doesn't have really valuable content to offer, who has not herself managed a classroom, who doesn't have skills and knowledge to contribute that family child care provider herself may not have. We invest a great deal in our staff and in their training. Speaking to Juliet's point, we really look for people who can engage both adults and children, which is really hard to do, and who can engage children while simultaneously explaining to other adults how they are engaging those children and why, right? Self-talking. Second thing, we focus on strengths. We really have a staff that walk into a program and see what's good first and build from the ground up there. This has to do with a relational approach to the work. It has to do with the way that we hope family child care providers see children, and it's fundamental to our staff's ability to make positive change for these programs. We value the whole person. That means going in and listening to what's going on in someone's life, recognizing that everything about her interactions in her daily engagement with her family members, for example, is going to affect her ability to work with kids, and helping her manage, for example, her stress, her personal health, her own well-being, her own business, so that she can be the best of herself when she is with children. Relationships, respect, and reciprocity. We value relationships above all else. Just as between adults and children, between adults and adults, it's not possible for meaningful learning and growth to happen without that relationship, that understanding, and that shared respect. We take a holistic approach to quality, which means we start with these tools that look at all aspects of quality and provider programs. But then we focus especially hard on teacher-child interactions and how we're actually not just maybe looking at the furniture and the space, though those are important, but really digging in most on the way that family child care providers are interacting with children. We engage stakeholders across the community. Oh, I could say so much about all of this, but I'm going to try and be brief because I see I'm almost out of time. But we engage stakeholders across the community, meaning wherever partners exist for us, whether it's the healthcare system, the Part C agencies supporting children with developmental delays, whether it's museums, libraries, the K-12 system, we try and get the stakeholders in those systems to think about family child care providers, how to engage with them, and make sure the children and families in their programs are getting access to any resources they have to offer. And finally, and most importantly, our staff are coaches, champions, and critical friends. They know how to give tough feedback, and they're not afraid to do that, but they're never going to do that until they've built a foundation, a set of relationships, and shared respect. And they're never going to hold providers accountable for anything that they would not hold themselves accountable to as well. So continuous learning, a great example. Our staff are always learning and growing, and they talk about how they're learning and growing so that they can model that for caregivers. I do see that there are a couple of questions. Are there other agencies like All Our Kin in your state? Is it competitive or collaborative? We are super collaborative. That's the point of our technical assistance initiative. There aren't enough of us doing this work, right, to go around. There just aren't. So the last thing we want to do is go in and disrupt good work that's already happening. In Connecticut, for example, we work in New Haven, Bridgeport, Stamford, and Norwalk. Those are 4 cities in our state. Hartford is a really big city in our state that has networks in place already. So we're doing a technical assistance there where we're partnering with those agencies to share some of the best of what we've learned and some of our most egregious mistakes, right? Because people learn best from others' mistakes too, and also learn from them around their best practices. I see there are more questions, but I'm going to pause here for reasons of time, and if I get to, I'd love to come back, and if not, I'm happy to answer offline later.
Thanks, Jessica. I get goosebumps every time I hear you talk about your program, and your enthusiasm is really contagious. I remember the first time that I heard you speak, I particularly remember you talking about the journey that you all help the provider embark upon, and you help her all along the way, getting to meet the goals that she's set for herself. And I want to thank you as well for generously sharing your lessons learned with others, and for being a leader in the field, and for partnering with the Quality Assurance Center and sharing your information. Thank you so much.
Oh, thank you.
If we have time, we'll circle back to those questions towards the end of the webinar. Right now, you'll see a poll. Hopefully you'll see a poll on your screen. We're going to just take a few minutes to check in with you because we're committed to continuous quality improvement. We have added a poll question here and later on in our presentation to get a quick check from you on what's been helpful thus far. In this first poll question, we'd like to find out how much was your understanding of staffed child care networks improved. If you'll take a quick response. Thank you for your input. We're going to go ahead and move forward now and share our third resource in the series, but we do value input, and we'll have another question for you later on in the webinar. For our next resource, we're going to look at estimating the cost of staffed family child care networks. This is a tool for estimating the costs associated with operating a network. The tool actually consists of 2 parts, a user's guide and the actual tool, which is an Excel file. So the user's guide is available on the Office of Child Care Training and Technical Assistance website, and you'll see the link here on the slide. And you'll also have access to, as Jen said, you'll have access to the PowerPoint slides at the end of the webinar. The Excel file is not available on the Training and Technical website, but you can request a copy of that Excel file by contacting the Quality Assurance Center. So Gina Capito is the author of the cost estimation tool. And Gina's here today to provide us with a demonstration. Gina designed the tool so it will help stakeholders better understand and estimate the costs of operating a family child care network. So Gina, let's see if we can do a live demonstration of the tool, show folks how it works. And if technology does not cooperate with us, we'll click back to a few screenshots that we have and work through the screenshots. But first, we'd like to try the live demo. So Gina, will you briefly show us how the Excel tool works?
Sure. Thanks, Michelle. Hi, everyone. So as Michelle mentioned, we're going to see if we can stretch the borders of technology here. I'm going to share my screen, and we acknowledge that during screen sharing with this large of a crowd on a webinar, we definitely run into instances where we have delays. So I'm going to go slowly to try and avoid that. While I'm in screen sharing, I'm not going to be able to see if folks have questions, so much like Jessica and Michelle said, we'll circle back to answering questions. If we don't run out of time in the hour, then we'll make sure we follow up afterwards. But we wanted to give you a taste of how the cost estimation tool actually functions, so you would be live in the workbook. So right now at this point you should actually see the cost estimation tool, which as Michelle mentioned is an Excel workbook. You should see that by my screen share. And so I'm going to walk us through actually completing one to generate a cost output for a certain style of family child care network. The cost estimation tool, as far as how it was built, builds upon the tool that was presented by Juliet, and then the tool that we discussed in more detail around the components and the technical assistance around actually building a staff network. This kind of culminates that information into putting numbers to the work so that stakeholders or individuals that are already doing the work of a staffed family child care network can really think about their costs and think about whether they could scale on additional services, make their services more intense. It's got several features like that. So we're going to talk through a base approach to completing the cost tool and see how the output works, so that then you have the opportunity after you request the tool from the center to do some of this very same work with it. So as we mentioned, it's an Excel workbook, and that's where we are right now. Michelle, if by chance you're not seeing my screen, go ahead and interrupt me and let me know.
I certainly will. Looks good so far.
Okay, we got it. I just figured before I plow ahead, right, make sure that we're all looking at the same thing. So what we see, we're going to start here on what the tab that's called, start here, Network Variables. And the point of this tab is where the user enters information about the size of the network, the number of homes that are going to be served, the number of children. Some of this can be approximate if you're building models and trying to consider what you can afford to deliver with your staff network. And you can run more than one example with different data. But this just gives you a sense of how it functions. You then also have some questions you have to answer around the model itself, and we'll get to those in a second. So we're going to start up here. I'm going to scroll up a little so you can see the very top. So as we said, it's a staffed family child care network cost estimation tool. And this is just cost. It's not generating revenue at the same time. It's just talking about how much it's going to cost you to do it. The first thing that you have to do, and you'll see from the flags over to the right where it says incomplete in red, is you have to enter this data. So you need to enter data around the numbers of things that are going to be served by the network. The first thing you need to enter, and I'm going to go ahead and run a model, is the number of FCCs that are going to be served. And so I'm going to say that we're going to serve 100 family child care homes. Then you need to enter, and you'll see when I move away from entering 100 that the red flag off to the side went away. So that's a way the tool functions, so that the places where you have to enter data, you're prompted to, so that you don't walk away from a tab and not have entered data and then wonder why your cost at the end isn't working out or doesn't make sense. So there's some little triggers like that in the tool to try and support you as at the end use stage. Then the next thing we have to answer is the total number of teachers/caregivers across all of these family child care settings. And you want to include the provider/owner as well as any staff that they might have. So we're going to go with that there's 125, that we've got family child care homes that also have assistants or staff that they've hired that work with them. And again, you see the flag go away, and then the total number of children that is served across these family child cares. We're going to say 500 children are served. And so all of this is critical because it all relates to cost output at the end, because many of the features and the services of the staff network are driven by the number of homes, the number of professionals they're working with, and the number of children. There's lots of per unit cost data that we're going to look at in a second. The next important thing, and I'm going to scroll us down and then pause because of the delay, we have to choose the model that we want to deliver with this staffed network. Again, this builds upon some of the research that we have up to this point on service delivery through staffed family child care networks. And so we have actually 3 options. It's base promising practice, most promising practice, so you see those 2 there, or a custom model, which we're going to talk about in a second. For more detail on the features of a base promising practice versus most promising practice, you have that detailed out in the user guide as well as here on the Model Components tab. And so I'll click us over here before we select our model and let you take a look at some of the detail here. So what these 2 models, base versus most promising practice, really what varies is the intensity of the services, so the number of home visits that a family child care provider receives from the network, and the volume of services that they're providing. So you'll notice that there's a core set of services that are being delivered, like coaching for instance. You see coaching cell here. But the difference, and this is broken down by visits, phone calls, emails, at the base model, we're talking about 6 visits to a home in a year. The most promising practice model, we're talking about 20 visits in a year. So you see right there, there's a significant difference in the intensity and the number of times that a family child care home would have a point of contact with the staff member from the network. And it goes forward. I'll make this a little smaller so we can scroll down. It goes forward across several other characteristics, which again are kind of building upon some of the strategies and things that Jessica has shared that they do through All Our Kin and what we found across family child care networks across the country in doing research to build these tools, things like training and whether they hold network meetings, whether they offer staff relief. So there's some core services, and then there are also some optional services that we know that many family child care networks offer, but that it's not consistent that every single family child care network finds the need to deliver those optional services. So we're going to hop back to that and talk a little bit about that. So what you're doing here though is just looking through the characteristics of a base promising practice model or the most promising practice model, because again we're not going to talk custom right now, and choosing which one. So I'm going to choose that we're going to deliver the base promising practice model, which is the less intense of the 2 models. Then I mentioned the last thing we need to answer to on this first tab is the potential of optional services. And as I mentioned, there's lots of optional services that we found were pretty commonly offered across family child care networks across the country, but we still wanted to offer them as optional versus building them into some of the core services, the things that we kind of believe are critical to the delivery of a staffed family child care network. And so you're able to opt in. And so what we're going to opt in on this model is we're going to go ahead and choose that we're going to deliver an annual conference. And you see by looking at this list here, there's a variety of other things. There's business support services, their administration of the child care food program, and you can see how this would be optional. In some communities, that might be a core feature of their family child care network to administer the food program. In other communities, there might be another structure that the food program is administered to FCCs. So it would be a duplication if the network did that too. So that's why that's a great example of something being optional. It's important that we opt in or don't opt in at this stage, but then maybe go back and do it later, because if we want to understand the costs related to those optional services, it's the selection here on this tab that actually links up to getting cost data related to them. So now let's take a look at the Expenses tab, because we've entered those basic variables around the model that we're trying to run, and it ties directly to this expense data. And the Expense tab, I'll scroll up to the top so you can see kind of how it's organized, has default expense information, and that's what's the highlighted yellow column, column B. You see all the data there that's highlighted yellow. Doesn't necessarily mean that everything that's there in the yellow fields is going to populate into your final output. It's going to populate based on those selections that you put on the first tab and some of the data that you filled in around the volume of your services and the type of model that you're running, the base or the most promising practice. And a great example of that is if you look here at column D where the FTEs are, you see that not all of the positions that are here are being populated in this particular model. And that's because there's ratios and there's numbers of staff tied into the number of family child care homes that's driven by the model. And again, the base promising practice model has a higher number of family child care homes to specialists that are serving those homes. The most promising practice has a lower number of homes in ratio to the specialists. So you're going to end up with more specialists if you're doing the more promising practice model, so therefore it's going to cost you more. You're going to have more FTE. And you'll notice that because we didn't choose to do the Food Program Administration, the CACFP, that position is not populated. We don't have a cost related, we don't have an FTE related to that position. The other thing that you see here, we'll scroll down, is all of the non-personnel related expenses linked to delivering the services of a staffed family child care network. And again, this was gathered across currently operating family child care networks. We looked at other resources like national PIR data on costs related to family child care services, acknowledging that the PIR is through the Head Start system, the Program Information Report, and then we also, across the team of experts that were supporting building the tools, used some of our own knowledge of costs and variables related to delivering these services to populate default expense information so we'd be able to come up with a dollar amount at the end of the day when we're running a model. And that gives you a sense of how things are being calculated too here in column C. I'll give it a second to refresh. And again, it's divided into personnel and non-personnel, and the personnel category has the most commonly occurring positions that we found across the work of looking at what current family child care staff networks are doing with family child care homes. So here's the big moment. Now the last tab in the model is the output tool. So this is the cost estimation tool output, and this is specific to the one that we just built. So going back, first thing that this page does so that you could run and print just this page and you'd have it all in one place is it summarizes the model that you were building. So again, we put in that we were going to serve 100 family child care homes, and we said that that would serve, there's 125 providers or staff at those homes, 500 children, and we chose the base model. So that's just a summary of information that we put in. It then summarizes the FTE that based on the ratios for that particular model or drives, it summarizes those FTEs. So we're looking at 4.58 total FTE, and that's each family child care specialist is serving 25 homes. That happens to be the ratio. So that's why we ended up with 4 employees in that area. And that's this cell here. You'll notice that it has formulas where it drives to management level, executive director, coordinator level positions. You can imagine that in a small network such as this, that you would not necessarily have 0.08 that maybe instead the executive director functions and the coordinator functions would be in one position, depending on the organization that it's located in and how that's structured. So, but these are formula driven, so it just gives you a sense of the volume of work to support that model. Then you also see the optional service that we selected, which was the annual conference. So it's all summarized there. And now we get into the expense data. So with those variables in mind and using the expense information that was on the third tab, now we have cost information. So it calculates our costs for personnel. It adds all those personnel up. It defaults that benefits are 20% of salary. You can change that if you know for certain in your community that benefits are higher or lower. But it does have a default value just to give you a sense. And then it gives you total personnel costs. That's what we see there in line 45 is the total personnel. Then, again, keeping the split between personnel and non-personnel, now all of the non-personnel costs associated with the delivery of services that this model, at the intensity the base model delivers them, are linked here. So training, for instance, is related to the number of trainings that this particular model offers in a year and has a per unit cost for those. You'll see that optional service that we selected is conferences, and the annual conference amount, the average annual amount for a conference that pre-populates is $10,000, and that's here. If we had not chose conference, there wouldn't be $10,000 here in non-personnel. Then the other non-personnel expenses kind of all populate here and give us to a total non-personnel and then a total annual expenses. So this at the $890,000 is a family child care network using the base model, which is 6 home visits per year, 100 family child care homes, coming in at a cost of $890,000. There's other things in there, obviously, that you can kind of think about changing, and that takes us to considering this idea of the custom model. So just take us back, just because I think I do have about a minute or two where I can just show you the custom model, just to give you an idea. So as I mentioned, there were three. We chose base, there's most promising practice, and then the custom model. And one of the things I think we find, and one of the reasons we built the custom model component, is because sometimes you might want some features of the base, and you might want some features of most promising practice, and then have something that varies from both of those. And the best way to do that versus running one base, one most promising, and then doing an average, you can do that with the custom. And I'll just quickly show you how that happens. So we're going to choose custom model here. And the first flag that we get as a user is that we must complete selections on the Model Components tab in order for the model to generate data for us, to generate an output for us. And so I'll show you what that looks like here on the Model Components tab. So we have the opportunity here with the custom variation. All of these fields, you're going to put in numbers for them. You can put in the number that's already there for base promising. So for instance, you want to stay with 25 family child care homes per specialist. So it went ahead and typed in 25 there. If you want to stay with 8 specialists per coordinator, or maybe we only want 4 specialists per coordinator, so change that variable. If there was no answer here, it is going to prompt you again with a red field that there needs to be data put in here, so that you will, again, it will have information to run those formulas and come up with the output at the end. But again, what this gives you the opportunity to do is tweak certain things that you want to look like the base or look like the most promising, but you want them to look a little different for your individual context or community. The custom model gives you that option. But it doesn't mean that you can't draw from those other two models for some of the answers to the questions, but you do have to go in and fill in all of these yellow fields. And you see lots of red flags over here to the right prompting you to that effect. So you do need to make judgment calls on these various things. How many network meetings you're going to have a year. Maybe you want to have 6 like the most promising practice, but you had less home visits than most promising practice. So that's why you chose a custom model. And that's what custom model gives you the opportunity to do. The other big thing that the custom model gives you the opportunity to do, and I'll scroll all the way down, is there is a whole section for optional employees. And so the custom option gives you the opportunity, and this particular custom option already has the first optional employee filled in as a CFO, and that if there's 100 FCCs, there'd be a full-time CFO. That's what's auto-filled in here. And these are areas that you don't have to fill them in because you can leave them blank if it's not applicable. So this is an instance where the red flag is a reminder, but if it's not applicable, you're not adding any optional employees, then you don't have to populate this section. Just quickly show you what the output looks like, how this is a little bit different because we did add some new things. Let me scroll down here. We need to, actually I have to take you back to screen, my apologies. You see that we have that first optional employee that we put in now is populated here, that CFO. We have to put in a salary for the CFO. Otherwise, we won't get an output related to a cost for that optional. So that's another place. And you see that it again, prompts us with red off to the side. So really watching for those red flags of text to the side of the cells tries to help guide you of where there are places where you absolutely have to fill in information to get your best output from the tool. So we'll just go ahead and say that the CFO is going to make $80,000, the same as the executive director, and then you'll see that optional personnel position on the final output page for this model, the custom model with the same numbers of sites, and that position then is calculated there. I'm going to turn it back to Michelle to see if there's any time for questions.
Thanks, Gina. That works beautifully. One thing I thought that I learned going through using the tool was resetting the defaults. Could you show us that real quickly about how they could save the scenario that they worked up, reset the defaults, and then enter a different scenario so they can do some comparison?
Sure. So here, because I just did a custom model and added a CFO position and I added a salary for that CFO position, Michelle's right. I did actually add something to the expense tab, which now is different than the default information that came in. So if I wanted to hang on to this, I would Just like saving any other document, I'd go to my file screen, save as, and I would save it as 9/2017 custom CFO, and that would be that version. Then I could open my document again because I saved this, and go in here, and this reset default expenses, I'll go ahead and click it. Cross our fingers that technology stays with us. I'm going to move away from the tab and then go back to it to see if it did it. It should. Then it resets all of the values that are here because we hand keyed this one. This one stays in, so you do have to watch if you're going to not do the custom model anymore. You need to go back and choose a different model. Choose off the custom model. So let's go back to the base, and we'll see that then all of our custom selections are wiped out. So our optional employee that had been right there is no longer there because we're no longer doing the custom model, and as well as all the other selections that we modified in the model itself, it defaulted back to the base, and now because we also told it to use the default expenses, it defaulted back to using the default expenses that are pre-populated. So it's a way that if there was something, like I mentioned, you could override the benefits percentage. That's a great example of it. You could override and say that benefits are 30% in your area based on your knowledge of expenses. If you overrode this yellow cell with 30%, you always have the opportunity to go back and hit the reset. Then it'll take you back to the original amounts. So you can play with the amounts but still have that fallback of getting the original values back on the screen.
It's really nice to have that opportunity to try some different scenarios because when you're exploring your different options, it's nice to be able to put a cost estimate to them. So, Gina, that live demonstration worked beautifully. Thank you so much. You did perfect on the timing, so we're going to move ahead, and we did receive a few questions, and we'll capture those and share those with Gina and get some answers prepared and shared with you all.
Thank you, Michelle.
I'll click through these slides real quickly so you'll see when you actually see the PowerPoint, you won't have the benefit of Gina's demonstration, but you will have multiple slides that show the screenshots of what she was talking about, and these will line up then with the information that's in the user's guide. Next, we're going to ask you to respond to another poll question. As soon as I click through here we go. So in this poll question, we'd like to get your feedback about today's demonstration using the cost estimation tool. Would you be interested in using the tool based on what you saw in today's demonstration? If you take a few seconds to answer. Thank you for your input. We're going to move forward. And again, please feel free to put any questions that you have in the chat box. I wanted to let you know that I hope you'll join us later this fall when we introduce the last two resources of the series of 5. We'll be introducing those in another webinar, and these two resources focus on policy assessment and planning, looking at guiding local, regional, and state efforts in promoting access to high-quality family child care options, And the last in the series is about engaging family child care providers and quality improvement systems. This last brief will outline outreach strategies and some initiatives to engage and support family child care providers. I wanted to say again thanks to our presenters today, Juliet, Jessica, and Gina, for joining us, taking time out of your schedule and sharing your knowledge and your experience with us. And we've thoroughly enjoyed partnering with you in the development of these resources. Since we weren't able to get to all your questions, remember we will share them with our speakers and prepare responses for you. We'd also like to thank you for your participation in today's webinar, and we hope that you find these resources useful. And you will receive, as Jen said, a quick survey as soon as the webinar ends. Again, it's additional questions to help us with our quality improvement initiative. If you'll take just a few minutes to respond to those survey questions as well, it will help us to continue to improve our resources, certainly improve our webinar presentations, and we want you to know we value and do appreciate your input. Thanks for joining us today.